Interstitial lung disease, or ILD, is a complication of myositis. What happens there is that lungs became inflamed, meaning that not by viral or bacterial infections, but really due to the autoimmunological processes. This tissue is then gradually replaced by scar tissue. This scarring makes it harder for patients to breathe and can progress unpredictably, sometimes very rapidly. And traditional tools like lung function tests only show us the damage that has already happened, while the CT scans tell us about the structure of the lung, but also cannot really tell us about the activity on this lung disease. And this is where FAPI PET comes in. So FAPI stands for fibroblast activation protein inhibitor. Fibroblasts are the cells responsible for producing this scar tissue. And when they are active, they express a specific protein which is called FAP. And by injecting a tracer that specifically binds to this protein, we can visualize the active fibroblast activity in the lungs using PET imaging. So the CT part provides the anatomy, and the PET shows us the molecular activity and dynamics. In simple terms, with FAPI PET-CT, we are not just seeing what lung looks like, but also where we can see or we can find active and ongoing scarring of the tissue. And this is why the potential to predict progression and much earlier than conventional tools can be done with this procedure. Our motivation was clear. Patients with myositis-related interstitial lung disease, they face unpredictable disease trajectories. So standard tests like pulmonary function test or CT scanning often fail to tell us who is at high risk of progression. We wanted to see if FAPI PET-CT, this kind of molecular imaging technique, could provide earlier and more reliable prediction.
This builds on a previous study that we published about 1.5 years ago, where we, in a small cohort of myositis patients with ILD, were able to show that FAPI PET-CT, this new technique, is able to distinguish between patients who are more likely to have progressive disease versus those who don't. And the additional advantage of this study that we did was not only that we did a 2-year follow-up, but also that we combined it with other multiple progression definitions, including functional decline, radiological changes, but also clinically relevant outcomes like hospitalization and treatment escalation. So this gave us a much richer picture of disease evolution. So at the baseline, the patients received the nuclear tracer, and we measured the uptake appears in the lungs, basically how active the fibroblast-driven scarring process is. And then we tracked patients over 2 years to see who progressed and compared that with their baseline scans.
Actually, what we can show is that patients who had higher tracer uptake at the beginning or inclusion, which we also refer to as baseline, were significantly more likely to experience worsening of their disease, of their interstitial lung disease, whether measured by lung function decline, CT changes, or the composite outcomes, including hospitalizations, treatment escalations, and so on.
So importantly, when we combine the results of the FAPI PET-CT examination with traditional tests like pulmonary function test, where we measure how the patient's lung functions works, or high-resolution computed tomography, which is the standard imaging method to look at changes in the lungs, the prediction became much stronger. So, for example, models, which included also the FAPI uptake, improved accuracy markedly, with cutoff values that could distinguish patients who are stable from those who are progressing. So for patients, this could mean earlier identification of risky disease, which would allow, of course, the doctors to adjust the treatment before irreversible lung damage occurs. So it's important to highlight that, of course, ultimately our vision is to integrate this molecular imaging into personalized care for patients with myositis-ILD. But again, it's important to highlight that this was a small single-center study. So the next step is to validate these findings in independent cohorts and additionally in large multi-center studies before it can enter routine clinical practice.